Hi, this is Jackie Gardner-Nix, and this is the next episode of our series Migraine from Both Sides that I'm doing with my colleague Christie Tate, nurse practitioner. So today we're going to have a look at chronic versus episodic migraines. Christie, would you like to speak about the differences?
Yeah, sure. So I think first of all, when we think of the term chronic, a lot of times this refers to something you have for a long period of time. And the reality with migraine is that most people have it throughout the duration of their life. So when we speak about migraine, chronic means something a little bit different. So chronic is somebody who experiences 15 or more headache days out of the month. Not all of those necessarily need to be full-blown migraine attacks. If 8 of those 15 headache days have migraine features with them, so some of that light sensitivity, moderate to severe intensity, then that is understood to be chronic migraine. And then we do see many chronic migraine sufferers that actually have 0 days where they're free of any head pain. So many chronic migraine sufferers have some degree of headache on every single day. Now, episodic means less than 15 days out of the month. And sometimes we even kind of break that into two subgroups, the low frequency episodic, which are sort of the lower, less than 10 days a month, and then the higher frequency episodic. And that usually tells us, are these individuals kind of on a trajectory towards chronic migraine? And it's a really important time to maybe do what you can to put the brakes on that train, so to speak, to actually slow down the frequency. It's much harder to treat chronic migraine sufferers, especially if they have some degree of head pain every single day.
Absolutely. And I think there are times in your life when you go through a phase of chronic migraine suffering, maybe because the stressors are much greater at those times. I remember I went through chronic migraine after my brother died somewhat prematurely at 59. And I had to help with the palliative care, of course, and then execute the will. And that was a time where I went into several months to a year of chronicity with my migraines, where my head was constantly sensitive. And at that point, my family sort of gathered around because, in fact, I was not making a lot of sense at times. And I remember my children, my adult children, were wondering whether I was moving into dementia even. And I wondered if I was moving into my first real depression, which was associated really with all those migraines. And in fact, at the time, I did look it up in the literature and found that there is a type of depression associated with chronic migraines that lifts when the migraines are treated. And so at those times, that is really important to look at whether you need to consult with your healthcare professional about using preventatives, which is what I did. So the sensitivity is worth referring to. And then there's also the medication aspect. Christy, do you want to allude to that?
Yeah, so I think what sort of naturally happens, if you have migraine yourself or somebody, you want to treat it with something. And the thing that we have readily, are readily available to us are these over-the-counter medications. So ibuprofen, acetaminophen, these kinds of things. And they seem fairly safe, they're easy to access, and we'll use things like that. Those are acute medications. There's often also prescriptive medications you can use to treat migraine. So those rescue medications that we take and we hope will bring down the pain and the discomfort and all those symptoms are very helpful to us. But when you start using them more and more frequently, you can actually increase the frequency of your migraine attacks. So it's a little bit of a slippery slope. So they can be necessary and life-changing to us, but if we become reliant on those too often, even if they're seemingly quite safe, something like acetaminophen, they can actually worsen the frequency of our migraine attacks and can contribute even to a more chronic frequency. So that's, like you had said, Jackie, is the time where you want to start thinking of actual preventatives, because those medications don't slow down the frequency. They'll kind of bring down an attack, but it doesn't mean you're not going to have a recurrence of another one, the next day or the day after, depending on your pattern. You mentioned a really kind of interesting feature that goes along with chronic migraine, and I get a lot of people asking, is this normal? That sensitivity everywhere. So we call it allodynia. It's a common feature in chronic migraine, and people will say things like it hurts to brush their hair or wash their hair. They actually have, pain that persists sometimes around their face and their scalp. And that's something that results from what we call central sensitization. And that's your kind of pain center being turned on all the time. So,
Yeah. There was a sense when I had that chronic period that anything would set off a migraine. I was on the edge all the time. It was very, very difficult to manage it. I wasn't overusing medications because I did know that, as a treating healthcare professional, I must limit the number of times I would take an anti-inflammatory to about 3 to 4 times a week. And even my triptans, which are also available to me, fortunately, and they do work, I had to limit the number of times I took those per week as well, and I limited myself to 3 per week. Thereafter, of course, it's ice packs and darkened rooms, and staying away from overuse. And I used to find that when I was treating somebody who was into overuse, that to say to them, well, you can't use those anymore, was devastating. Because what would they do? Because the migraine would come back so fiercely. The other thing, too, actually, is that we became aware along the way that opioids would actually not only, I mean, yes, they would treat by bringing the pain down, but they could also make the migraine never go away. There was an interaction between opioids and migraine headaches that was, it was bad. And we were therefore having to deter people from using those common things, maybe the acetaminophen plus codeine that you can buy across the counter and sometimes take far too much of, or the ones that are the next level up, where the codeine is at a higher dose and is prescribed by your prescribing physician. There's also the one that is a combination of acetaminophen and oxycodone. Those kinds of things are opioids. And some people don't realize that they are opioids. Codeine and oxycodone are opioids. So overuse of those can be a problem as well.
yeah, and I think I'm seeing less and less of people using these medications, but to your point, when you're telling somebody, this is kind of making things worse, I think it almost feels like the rug is being pulled out from under them, right? You're just taking away that lifeline. And I think most of those chronic migraine patients know that, it's maybe making things worse, but for at least some duration of time, it will sort of take the edge off or bring things down. And that's all they need to get through their function, their commitments, whether they have, kids or a job or, their life to get back to. So yeah, putting in the kind of support, and that's really where prevention comes in, right? So prevention comes in the form of lifestyle and behavioral sort of strategies, as well as, prescriptive medications when needed, but usually it's really a integrative approach of several things, and that over time they will need that acute medication, ideally less, but also it becomes, you respond to it a little bit better. I don't know if you ever found that to be the case with yourself, Jackie, that when you were sort of in a better controlled state, that maybe just one triptan would work faster and much better rather than just kind of dialing down a little bit of the pain and it taking that edge off.
Yeah, I think that's true of many medications, that if they're used infrequently, they work much better. The body doesn't become as used to them, and therefore you just respond. But there's many medications where that occurs. So we've talked about chronic and episodic migraines. We will be talking in a future session about lifestyle changes and also a little bit more detail about treating the migraines that are episodic. Thanks, Christie. We'll sign off. Thanks for watching.